committed with another batches at 4 to 5 p.m. for this day only. So very sorry for the inconvenience. Okay, so today we have a 1.5 hours class only. Okay, tomorrow I will complete the chapter, and because on 4 to 5 I have committed with another batches, so that's why I am telling you. So sorry for the inconvenience. Okay, so here we have to start from replantation is over, grafting is also over. Okay, so can we up and modify 62 with the grafting for bone graft?
No, ma'am. No, ma'am.
Should not up and modify. What is the meaning of 62 modifier?
Two surgeons perform the same code.
Two surgeons working together for the same surgeon. And these are the code section for grafting. For graft, minor or small graft 900, major or large graft go for 902. For costochondral, that means costochondral is nothing but as a rib cage that present cartilage. Costo means cartilage. Chondro means cartilage that are present at the rib cage. So cartilage, that means ribs cartilage grafting 910, nasal septum graft 912. So these are the code section for bone graft. Okay. Then in our musculoskeletal system, we already discussed on our last session. So we have to apply the code based on the procedure. We have to apply the code based on the procedure. Based on the procedure only, you have to apply the code. For example, patient admitted with the admitted with the closed fracture, leg fracture. Patient admitted with the closed leg fracture, but the doctor performed open surgery. Here, we have to apply the code for open surgery. For CPT, we should select the appropriate code for open surgical procedure, and for ICD, we should report the code for closed fracture. For ICD, because the condition is closed fracture. For that closed fracture, now doctor perform open surgery. So the surgical method is open. So the corresponding open procedure code should you select from this chapter, from CPT book. So that's why here we have to apply the code based on the procedure. So here arthrotomy. Tomy means cut. Temporomandibular joint. Doctor make a cut on the temporomandibular joint. Go for 21010. Arthrotomy, temporomandibular joint. So surgeon make a cut on the temporomandibular joint. Go for 21010. For bilateral procedure, you should up and modify 50. This is a temporomandibular joint. Am I right? This is a temporomandibular joint. So surgeon make a cut on the joint, temporomandibular joint. So go for this code, 21010. So 21010 for temporomandibular joint. For bilateral procedure, should up and modify 50. Then what is the procedure? Excision is the procedure. Excision of tumor. Excision of tumor is the procedure. Anatomical location is face scalp. So now check that here also excision of tumor, face scalp. What is the difference for 11 and 13? What is the difference? Yes.
Less than 2 centimeter and 2 centimeter or greater.
both are same, less than 2 centimeter. That means
Subfacial and subcutaneous.
subcutaneous,
13
for subfacial. So subcutaneous means go for 11 and 12. Subfacial means go for 13 and 14. Okay, 13 and 14 for subfacial. For subcutaneous removal of tumor means go for 11 and 12. So same like that. For less than 2 centimeter of tumor, 11. 2 or greater, 12. Same like that, 13 and 14 for subfacial removal of tumor from face and scalp. Less than 2 centimeter, 13. Greater than 2 centimeter, 14. That's it. So the above 2 code section for subcutaneous, then the below 2 code section for subfacial. That's it. Then manipulation. Manipulation of temporomandibular joint, TMJ joint. For manipulation of temporomandibular joint under general or monitored anesthesia care, requiring anesthesia. Guys, please listen. Doctor manipulating the temporomandibular joint. Manipulation of procedure is manipulation. Anatomical location is temporomandibular joint. Usually, these procedures have been done by using a anesthesia. Suppose if a doctor use general or monitored anesthesia care means go for 73. If anesthesia not used means we have to report the code from medicine chapter. So without anesthesia, go for the 9 series, 97140 from 98925 to 29, 98943 like that. So if anesthesia is given means go for 73, 21073. If anesthesia is not given means go for the 9 series, medicine chapter. Did you understand?
Yes, ma'am.
Then this is also the one of the important question, head processes. Head processes means artificially making the eye, ear, nose, intraoral obturator like that. So artificial process to that means doctors make a artificial eye, ear, nose like that. So in this, so here see that based on the location we have to select the code. For surgical obturator 76, orbital means go for 77 like that, mandibular. So what is the guideline? It's a direct coding. What is the guideline? Actually, if you want to report the code from 21076 to 21089 means doctors, that means that provider want to design and prepare the processes own. Should not buy the product from the outside laboratory. Okay, should not buy the product from the outside laboratory. For example, Brinda, she is going to insert a device for a patient. Brinda, she is going to insert an artificial eye for a patient. So if you want to report the code for this, if we want to report the code from 21076 to 21089 means Brinda want to measure and design and prepare the processes. So Brinda wants to design and prepare the processes. Should not buy the product from the outside laboratory. Then only we can apply the code section from 76 to 89 for Brinda. Okay? Because it's a very expensive service. Then the first line, 21076 to 21089. 21076 to 21089 for professional service. As a D for these code sections are professional service, should not upon modifiers 26. Should not upon modifier 26 along with the 21076 to 21089. Take a note. Modifier 26 along with the 21076 to 21080. Did you understand the concept? Did you understand?
Ma'am, can you explain
Yes,
how
ma'am.
this professional components have been included?
Like
Like for
professional
21076?
from
Like
210.
how?
See that the first line. As a default, 21076 to 21089 is a professional service. So no need to up and modify 26 separately because 26 modifier is also for professional service. Am I right? 26 modifiers
Yes.
also
Yes.
for professional service. So as a default, these code sections are used to report the professional service of the provider, because if provider want to prepare the product, mean your provider want to take the measurement of that eye ear, then only he can able to make the design and prepare the processes. So that's why with this code section, professional services inclusive. Did you understand, Meenakshi?
Yes, ma'am. Just can you explain one code like that, how it is when we can conclude from that by reading the code itself?
1 minute. I just give an example for regarding of this question. 1 minute. I just.
Okay.
1 minute. I just start the screen. After that, I will share you. It's useful to understand the procedure. Decision design and the design and prepare the processes for palatal lift processes. How should you report the physician professional service for this procedure?
Option A, ma'am.
Option others. Okay, check your answer again, guys. Please, everybody, try to take the answer. Is there any new joiners today?
Option A.
Option A is the correct. Okay, 1 minute. Hello, Devaki. Why? Because here we did not up and modify 26. Because as a default, this is a professional service. As a default, this is a professional service. That's why no need to up and modify 26. Did you understand?
Yes, because the physician designed and prepared that process. That's
Yes.
that is already with.
Because if a provider want to design the processes, means providers want to make the measurement of that eye, artificial eye, want to make an exact measurement. Then only provider can able to create a perfect eye or a perfect ear. Am I right? So that's why doctors analyze the patient and they take the measurement. After that, he design and prepare the processes. So that's why no need to up or modify 26 along with the head processes code section. Okay? So 21310 is a deleted code. Just leave it. 21310 is a deleted code. Just leave it. Now 21310. So the procedure is closed treatment of nasal fracture. So the procedure is closed treatment. Doctor give a closed treatment for the patient. Anatomical location is nose. For closed treatment of nasal fracture without stabilization 315, with the stabilization 320. Without the stabilization is nothing but to make the that means doctor insert any device or any fixation to fix the fractured site properly, for proper location, for proper joining. Okay, for proper joining, doctor will insert the device externally or internally. That is called as stabilization. Okay, so after that means what is the reduction of fracture? Doctors make a procedure to correct they are doing some procedure to join the bone together. So in that case, they will externally or internally insert any of the device for the proper position. So that's why here doctor just to give a closed treatment only, but they did not apply any device externally. That is without stabilization. Suppose if they are applying any, means that is stabilization. Okay, step 1, like closed treatment 1. Apply any supporting device. Okay, so that is here like that. Externally applying device. This is not a open surgery. That's a closed surgery. Okay, so that is stabilization. Did you understand the meaning of stabilization?
Yes, ma'am. Yes, ma'am.
Without the stabilization 315, with the stabilization 320. So here location is same, nasal, but open treatment. First you have to check whether the procedure is closed or open. So if if it is a closed procedure, means go for 315, 312, 320. For open treatment, nasal fracture 325. So for uncomplicated. Complicated means doctor definitely insert any device, internally or externally. So doctor perform open treatment to reduce the fracture of nasal. Go for 21325. Suppose if a provider externally or internally apply device, means go for 330. So here internal and or external skeletal fixation is the key term. Internal and or external skeletal fixation is the key term. Okay. Now check that what is the procedure of and what is the anatomical set of 21336? 21336.
Open treatment of nasal septal fracture.
Nasal septal. The above core section for nasal. Then the below two core section for nasal septal. For nasal septal, open treatment 36. Nasal septal, closed treatment 36. Nasal septal, open treatment 36. Nasal septal, closed treatment 36. That's imaging guidance. For percutaneous treatment, doctors use any of the imaging guidance. So for trocar or needle, that is a device for sample of trocar and needles are used to obtain the sample. Usually for diagnostic procedure only, they are used trocar. Okay, trocar or needle. For therapeutical purpose, sometimes they will, for percutaneous also, they will use percutaneous diagnostic procedures also, they will use imaging guidance. Whatever it is, for percutaneous method means whether it is a diagnostic or therapeutic, whatever it is, for therapeutic purpose, percutaneous approach, doctors use any one of the imaging guidance, especially for treatment purpose, especially for the treatment. Definitely they will use any one of the imaging guidance. Okay, that's it. Then arthrodesis. So take a note, arthrodesis is also called as spinal fusion. The another term of arthrodesis is called as spinal fusion. Please take a note. Arthrodesis means spinal fusion. So here, according to the approach, here we have three classification. Anterior approach. Anterior means the device has been inserted front portion of our vertebra. So the two screws were fixed above the level and the another screws were fixed under below the level. Above the level, then the another two screws were fixed below the level. Okay, so here, according to the approach, here we have three classification: anterior, posterior, and lateral. So for anterior approach, the core sections are start from 548 to 586. Posterior 590 to 634. Lateral 534 to 534. So 32 to 34. Please take a note.
Noted, ma'am.
No. So here, arthrodesis, posterior approach. Posterior or posterior lateral technique. C level. Cervical, 600. Thorax, 610. Market Street, 612. Each additional vertebral segment, 614. Each additional vertebral segment go for 614. 614. இதை எழுதி வச்சிருங்க தேனு, நான் பாத்துக்கிறேன். யாராருன்னு எழுதி வச்சிருங்க, நான் நாளைக்கு நான் உங்கள்கிட்ட கேட்டுக்கிறேன். அவங்க ஹெச்ஆர் டைம் நான் கன்ஃபார்ம் பண்ணிட்டு தான் நம்மள அலோவ் பண்ணணும். Okay, now the example is L1 to L4. L1 to L4. Between L1 to L4, one minute I show you. Starting point is L1, then the ending point is L2. So, arthrodesis posterior, through the posterior approach, doctors perform the procedure from L1 to L4. L1 to L4. So, the starting point is L1, then the ending point is L4. Between L1 to L4, so how many segments are present means L1 to L2, L2 to L3, போட்டிங்களாங்க? சரி, நான் பார்த்துக்கிறேன். L4, there are three segments are present. L1 to L2, L2 to L3, L3 to L4. So the location is lumbar. So go for first level double to 612, then remaining two segment. For the first segment double to 612, then the remaining two double to 614. Yeah, because this add-on code for cervical, thorax, lumbar also. So double to 614 into 2. Did you understand?
Yes, ma'am.
Okay. So double to 612, double to 614 into 2. Now try this question. Now T3 to T7. Now try this question now. Yeah, now T means what is that? T means thorax. T means thorax.
22610, 22614.
First, how many segments that are present between T3 to T7? T3 to T4. Okay, first, so 5 segments. So that is T3 to T4, T4 to T5, T5 to T6, T6 to T7. Now, how many segments now? How many segments?
4.
Guys, don't calculate the first one because the starting point is the T3, ending point is T7. So there are four segments are present. So now the thorax means 22610. Am I right? So for thoracic 22610. So 22610 for first segment. Then the remaining two segment 22614 into 2. Into 2. Did you understand?
Ma'am, remaining 3 are that, ma'am? 2 is 3.
Yeah, one.
Two,
Yeah,
three.
remaining. Yeah, remaining.
So, into
For
3
first
only.
one 22610. Then the remaining 3. So 22614 into 3. Correct.
Okay.
Any doubt?
No, ma'am. No, ma'am.
Okay. Take a key point. Check that the approach of what is the approach of arthrodesis in this example? Posterior approach. How many segments between L5 to S1? 1. Because the ending point is L, starting point is S1. So C7, T12, cervical 7, thorax 12, L5, S5. So there are 5 levels that are present in our lumbar. So here doctor make a screws at L5 and S1. So the starting point is lumbar. So there are only one segment is here. So we should consider it as a lumbar. Only one segment. So that's why 22612. And along with the arthrodesis, doctor also perform iliac bone graft. Martialized autogenous iliac bone graft. For that, we should report 20937. For that, should report 20937. Here, if a doctor provide arthrodesis, along with the grafting means we have to report both of the both. So this example is also present in our book, guys. Then sorry, one more important. With the bone graft, we already discussed that with the bone graft, we should not report the code for, we should not up and modify 62. With the bone graft, we should not up and modify 62. We already discussed that. Then, with the arthrodesis, So with the arthrodesis, Sudarshini is present today. Okay. With the arthrodesis, if instrumentation is performed, means we have to report the code for instrumentation also. So in instrumentation, we have two classification. In instrumentation, we have two classification, non-segmental and segmental instrumentation. Non-segmental and segmental instrumentation. Non-segmental means doctor just make a proximal and distal hook only. In non-segmental instrumentation, doctor just fix a proximal hook and distal hook only. In segmental instrumentation, doctor fix proximal, distal and intermediate hook also. Proximal, distal and intermediate hook also. Okay. So based on that, we have a classification of that instrumentation. Segmental, doctor just fix proximal and distal hook only. But in segmental instrumentation, doctor fix proximal, distal and intermediate hook also. So these are the core sections for spinal instrumentation.
Excuse me, ma'am.
Yes?
Ma'am, this is the continuation of previous topic or this is the new topic, ma'am? because
Actually,
I have
this is
joined
a continuation chapter. I think this is your first session. Am I right?
No, ma'am. I was previously attended, but today I went to college and I got late, ma'am.
Today, I shared in all group, ma.
Yes, ma'am. I received, but today I was late joined.
Oh, late join. Okay. Actually, this is a continuation. Actually, before that, I just complete 2, 3, 4 slides only. Okay, that's it. Again, I will plan the session. You can attend 4 slides only. Okay,
From graft, I have not listened, ma'am.
Yeah, from graft 1, 2, and 3, 4 slides are here. So arthrodesis is a second. Only 4 to 5 slides only completed.
Okay.
So now in this example, instrumentation is here. If instrumentation is anterior means arthrodesis is also anterior. If instrumentation is posterior means arthrodesis is also posterior, vice versa. Okay, sometimes because in this example, one minute I show you. So I will show you later. So for example, this is a code section for posterior segmental instrumentation. So the corresponding key terms are the key terms for segmental instrumentation. Pedicel fixation, dual rod with a multiple hooker, sublaminar wire. These are the key terms for segmental instrumentation. Here for 3 to 4 segment, 3 to 6. So not only for 3, for 2 segment also we can apply this Adam code. So in that code description, it is start from 3. For 2 segment also we can apply the code. For 3 to 6 segment, 22842. 7 to 12 segment, 22843. And 13 or more segment, 22844. So here also like arthrodesis, here also we have a classification of anterior and posterior. I think intervertebral instrumentation is deleted. I think so. Then for anterior non-segmental 22840, segmental 4244. Anterior non-segmental 45 into 47. Please take a note. Then along with the instrumentation also, we should not up and modify 62 as well as 50 and 51. So like graft with the instrumentation also, we should not up and modify 52 as well as these are the add-on code. Am I right? Can we up and modify 50 and 51 with the add-on code? No. So should not up and modify 50 and 51 with the add-on code. That's why with the instrumentation code should not up and modify 50, 51 as well as 62. So please take a look, guys. Perform arthrodesis, bone graft as well as instrumentation. So we have to report all of the code. We have to report the code for all of the service. So here doctor insert, doctor perform arthrodesis, bone graft and instrumentation. So here doctor mentioned posterior arthrodesis but did not mention the instrumentation. Is it here doctor just informed that this is a posterior arthrodesis. So if arthrodesis is posterior means instrumentation is also posterior. Here doctor just informed that the arthrodesis is a posterior procedure but did not mention the instrumentation. If arthrodesis is posterior means instrumentation is also posterior. If arthrodesis is anterior, instrumentation is also anterior, vice versa. So now What are the procedures are performed here means arthrodesis, bone graft, and fixture instrumentation. So how many segments that are present between L4 to S1?
Two, sir. Two.
Okay. How many segments?
Two step.
2. L4 to L5, L5 to S1. L4 to S1. Am I right? This is our question. So between L4 to S1, L4 to L5, then L5 to S1. So there are 2 segments. So in that, there are 2 segments. So in that, 22612 for first segment, then the remaining next segment, then the remaining 1 segment 22614. Then 22842 for instrumentation code. So here one will show you. Instrumentation 22842. So as I told you already, we can able to report this code for 2 segment also. We can. So but in this code description they mentioned 3 segment, 3 to 6. For 2 segment also we can apply the code 22842. So here there are 2 segment only. Pedestal screw fixation is the key term of segmental instrumentation. Pedestal screw fixation is the key term of instrumentation. Segmental instrumentation for the 22842. Then 20937 for martialized autogeneous iliac bone graft. 20937 for iliac bone graft. Here we have to report the code for arthrodesis, graft and instrumentation also. Clear? Did you understand? Did you understand any doubt? Guys, am I audible?
Tell once again, ma'am.
No. Then, with the arthrodesis, if provider perform any other procedure means we should report both of the code. Should append modifier 51 also. For example, with the arthrodesis procedure, now doctor perform carpectomy also. With the arthrodesis procedure, doctors also perform carpectomy. So first we should report the code for carpectomy. Along with should report the code for arthrodesis with the modifier 51. So we should consider as a multiple procedure. So here 22558. Is this a anterior arthrodesis or a posterior arthrodesis, guys?
Anterior.
Because instrumentation is anterior, so arthrodesis is also anterior. For anterior arthrodesis, between L1 to L3, 2 segments, L1 to L2, L2 to L3. Then for the first segment 22558, then the remaining one 225, 20931 for structural alignment. Did you understand? Any doubt, any question? Because this is a very, very, very important, guys. Any doubt?
No, ma'am.
Shall we go to the next? Okay. 1 minute. Soundarya is absent. Okay. Soundarya is Sudarshan. Sudharini. In that 1 minute, I just did it. Monisha. Anisha, Monica. Together. Can we up and modify 62 with the bone graft and the instrumentation code?
No, ma'am.
Why means bone graft and the instrumentation usually performed by single doctors only, single physician only. Bone graft and the instrumentation usually performed by single physician only. So that's why no need to should not up and modify 62 with the bone graft and the instrumentation code. So this is a continuation of the previous one. Here, what is the meaning means? Both surgeon A and surgeon B working together to complete the arthrodesis procedure at the level of L3 to L4, L4 to L4. Surgeon A and surgeon B both are working together to complete the procedure of arthrodesis along with the arthrodesis at the level of L3 to L4, L4 to L5. Then surgeon B only perform bone graft. Then both surgeon A and B working together to complete the arthrodesis procedure. Surgeon B, then along with surgeon B only perform the bone graft procedure. So here they are working together. Am I right? So we are reporting the same code for both of the physician. 22558 for first level. So 62 modifier. Then for next level, for L4 to L5, 22585, 62 modifier. So you have to report arthrodesis code for both of the physician with the modifier 62. So you should up and modifier 62 for both of the physician. You should up and modifier 62 for both of the physician. Then Dr. B only perform bone graft. That's why we should report the bone graft code only for surgeon B. Did you understand? Did you understand? Here, doctor, 1 minute. Surgeon A and B. Surgeon A and B. Surgeon B perform arthrodesis. Surgeon B. So they are working together. Am I right? They are working for the single surgery, arthrodesis. So that's why here we are reporting the arthrodesis code for both of the physician with the modifier 62. So as per our general coding guidelines, we have to up and modify 62 for both of the physician. For add-on code also should up and modify 62. So here we are appending modifier 62 for both of the physician. Both of the physician because they are working together. And the surgeon B only perform arthrodesis. So sorry, bone graft. That's why here we are reporting the bone graft code for B only. Did you understand? Yes, sir. Okay.
Is there any example question for us to try, ma'am?
Sorry?
Is there any example question for us to try, ma'am?
Actually, there is no example question. 1 minute, I just give because all of that information, examples are given in that 1 minute, in that slide. So that's why we do not have a separate example. I just give you regarding of arthrodesis. 1 minute. Surgeon A. Please try this example. A perform. 1 minute. Posterior arthrodesis. Posterior arthrodesis at L L2 to L5. L2 to L5. Hey, shut up. Surgeon B also perform posterior arthrodesis. And surgeon B only perform or bone graft. 1 minute, I show you the bone graft. Martialized, okay, martialized bone graft. Okay. Now try this question. First of all, try this question. After that, I will give an answer for you. Martialized. Yes, okay. Now try this.
$62.
Then how many levels between L2 to L5? 3 levels. L2 to L3, L3 to L4, L4 to L5. There are 3. So 612.
22614
22611 22612 22614 into 2. Actually, the sound is coming again. So here we should up and modify 62 for surgeon A, as well as should up and modify 62 for surgeon B. So same code should you report for surgeon B also, because they are working together. So that's why we have to report both code for both of the physician with the modified 62. Then along with should report bone graft code. What is the code for martialized bone graft? One minute. Martialized bone graft code is 20937. Am I right? So we should report 20937. Because surgeon B only perform bone graft, that's why here we are appending the bone graft code only for surgeon B. Did you understand now?
Yes, ma'am.
Others, did you understand?
Yes, ma'am.
Yes, ma'am.
No. Now, vertebroplasty. Vertebroplasty means filling of cement material into the vertebral body. See that. Filling of cement material into the vertebral body. So injecting of cement material into the vertebral body. That is vertebroplasty. So cervicothorax means this code can able to report for both cervical and thorax. Same code would you report for both cervical and thorax. For cervicothorax 510. Lumbosacral 511. For each additional vertebral body 512. See that. This is a single piece of vertebral body. See that this is a vertebral body. For each vertebral body, we should report 22512. Okay. What is the meaning of vertebroplasty?
Feeding of cement.
Surgical repair.
Filling of cement material. Then vertebral augmentation means cavity creation. Cavity creation. I tested it. Cavity creation is nothing but doctor make a empty space, create a empty space at the vertebral body. After that, he filling the material means go for 513. Guys, in that doctor just injecting the cement only. But in vertebral augmentation, first of all, doctor will create a cavity. After that, he fill the cement material. That is vertebral augmentation. So go for thorax 513, lumbar 514, each additional vertebral body 515. Did you understand? Did you understand?
Yes, ma'am.
See that? Open treatment of femoral fracture 27236. Percutaneous treatment of femoral fracture 27235. For open treatment, we should report 27236. For percutaneous treatment 27235. Direct coding. What is the meaning of amputation?
Removal.
Removal. Cut. Now doctor make a cut on the mid-tarsal 800. Trans-metatarsal 805. Metatarsal with toe 810. Metatarsophalangeal joint 820. For interphalangeal joint 825. So 2 AA25 for interphalangeal joint. Okay. So these are the code section for casting. What is the guidelines of casting? What is the guidelines of casting, guys?
Yeah.
First time should not include the casting. First time procedure. It includes with the procedure.
With the fracture.
Fracture means it includes with the procedure, but just casting means we should code.
Okay. Then when we apply the casting code at second time.
Separately we should code.
On the second time. With the fracture care treatment, casting is inclusive. Should not report the casting code separately at first time. From the second visit, we can apply the code. As well as doctor just applying the casting only to perform the procedure. Doctor did not perform any open surgery, did not any other procedure. He just applied the casting only to reduct the fracture. Means we can apply the casting code at first time also. Okay. See that according to the location, thigh, one thigh, both thigh, head, same like that. So these are the code for cast, split, strap. Okay. This is a basic guidelines. Based on the location, we have to select the appropriate code. Any question? Any question?
No.
Then, so when very important, with the surgical endoscope, not only for endoscope, with the surgical procedure, diagnostic is inclusive. So as well as with the surgical endoscope, diagnostic is inclusive. In the same anatomical site, we already discussed in our respiratory system. In the same anatomical site, if a provider perform both the surgical and the diagnostic means, code only for surgical. If anatomical site is differ means, we can report both surgical and the diagnostic. 1 minute. In right side, doctor perform surgical and the diagnostic. In left side, doctor perform now. First, try this question. What code would you report for diagnostic or surgical?
Surgical. Surgical.
Surgical only. And the diagnostic means code only for surgical. Okay? Did you understand? Did you understand?
Yes, ma'am.
Okay. So if the different anatomical site means we can code both. We already discussed that. So in right side, doctor perform surgical. In left side, doctor perform diagnostic means we can apply both of the code. But in the same anatomical site, surgical and diagnostic perform means code only for surgical. So that is a thing that this information is also present here. With the surgical endoscope, diagnostic is inclusive. With the surgical endoscope, diagnostic is inclusive. Okay. Now see that temporomandibular joint, diagnostic. See that this is a temporomandibular joint. Am I right? Temporomandibular joints, diagnostic 800, surgical 804. Temporomandibular joint, diagnostic 800, surgical 804. And temporomandibular arthroscopy shoulder. The above two core section for arthroscopy TMJ joint. Then the below core section for arthroscopy shoulder arthroscopy. Okay, shoulder arthroscopy. Manjusha?
Yes, ma'am.
Manjusha, just now you joined, am I right?
Yes, ma'am.
Why, Manjusha? Diagnostic 805, surgical 806. Okay, one minute, just to take a note. Meniscus, see that. Medial meniscus and lateral meniscus that present in our knee. Meniscus ectomy, if removal of meniscus both medial and lateral means go for 80. Removal of meniscus both medial and lateral 80, medial or anyone. Doctor remove the meniscus either right or left, go for 81. So removal of meniscus, medial and lateral. Repair means doctor just make a suture. Doctor just make a suture, either right or left, either medial or lateral 82, both means 83. Medial or lateral 82, both means 83. So the above two code for removal of meniscus, then the below two code for repair. Just a surgeon just to make a suture of meniscus. Okay. So the information is given. So usually what is the reason for that meniscus tear means? Due to age factor or due to any injury, due to acute injury or due to degenerative disease. Commonly, these two reasons are the common reason for the meniscus tear. That's it. So this is the last one. Very, very important. First, doctor start the procedure with arthroscopy. But due to complication, he convert the procedure into open means code only for open surgery with the modifier 22. Guys, please listen. Doctor, first, please take a note. First, doctor start the procedure with the arthroscopy. Okay. Due to some complication, he convert the procedure into open surgery means code only for open surgery with the modifier 22. Did you understand? Did you understand? Any doubt? Okay. First of all, doctor start the procedure with the arthroscopy. Due to some complication, doctor can't able to perform the procedure well. So that's why he remove the arthroscopy and convert the procedure into open surgery means code only for open surgery with the modifier 22 because they are spending sometimes with the arthroscopy. So that's why we should upon modifier 22. Clear now?
Yes, ma'am.
Okay guys, session is over. Tomorrow I will give some practice question regarding of that. Okay, because I have another session. Is there any doubt with our today's session? Any doubt?